Hello, everybody, and welcome to our very last lecture of the semester. In today's class, we are going to be breaking up the presentation into three different sections. And in these three different sections, what we're going to be covering is three major types of disorders that are out there, or at least some of the more common disorders that we see nowadays. These three major disorders that we're going to be discussing are anxiety disorders, mood disorders, and then we're going to give a brief description of kind of a classification of disorders, but we often just give it one name called schizophrenia. We'll be discussing the symptoms, the prevalences, and different types of disorders embedded within all of these throughout the class. But again, instead of having the typical two parts that we've had in every other class, we're going to be breaking this up into three different sections so we can give each topic its due diligence. That doesn't mean it's going to be a 3 hour long lecture. Instead, the presentations will be a little bit under 40 minutes probably for each of them. So don't fret, don't worry, you'll still get the same amount of time presentation. It's just a little bit easier to break things up this way. But without further ado, what we'll do is start with the major classification of what we call anxiety disorders.
When we talk about anxiety disorders, we usually break it down into four different categories. At least that was the way we did it in the fourth edition of the DSM. In the fifth edition of the DSM, usually what we're looking at with anxieties is three different categories. Obsessive compulsive disorder, which was a category within the DSM-4 of anxiety disorders, has now been moved to what we call an impulse control disorder. But the other disorders listed under that umbrella are still there, and those are generalized anxiety disorders, panic disorders, and phobias. What we're going to do in today's class is going to break down these three different types and also discuss one that was in the DSM-4's version of anxiety disorders, and that's obsessive compulsive disorder. And I'll explain why some people still kind of pair it up with these, even though there is a recognition that there is a slight difference between obsessive compulsive disorder and these other types of anxiety disorders that are out there.
The first anxiety disorder we're going to start with is generalized anxiety disorder, because this one really kind of indicates the whole idea of anxiety disorders. In essence, what we see with people who suffer with generalized anxiety disorder is that throughout their entire day, in fact, for a large portion of their life, they're usually plagued by this free floating level of anxiety. In essence, for these people, almost everything they encounter can produce large amounts of stress. So if you see somebody that's constantly upset all of the time about something, they're stressed because they have an exam, then they're stressed because they have to comb their hair straight, and then they're anxious about needing somebody, and they're anxious about kind of being able to dress appropriately. If this anxiety just really encompasses their life, just really takes over a number of different things that they're doing, this person probably has generalized anxiety disorder. It's not that common. It's only found in about 5 to 6% of the population. But when it's there, it can be very, very impactful for these individuals. Oftentimes, when we're testing for generalized anxiety disorders, we can't necessarily ask people how tense they are all the time because they tend to attribute their tension to situations and of things in the environment that are causing it. So what we often do was use different types of tests, very subtle tests, to see if people tend to kind of have an inclination for generalized anxiety disorder. One of the ones we often will do is something called a startle test, where we will make a loud sound next to the ears, not loud to the point where it's deafening, but loud to the point where it's surprising, next to the ears of the people who are struggling with this disorder. And what we'll often see is a very strong, what we call startle reaction. All of us, when there's a sound or a noise, something upsets us, will jump, will react. But for these individuals, their reaction is much more pronounced. So oftentimes they'll kind of be overwhelmed for a short period of time. And in fact, some of them might even break into tears or be very upset by this particular interaction. If that particular test is not something we want to use, just because it sometimes bothers people or rubs them the wrong way, another thing we can actually do is ask about sleeping history. Oftentimes what we see with generalized anxiety disorder is that these stressors, this tension, can actually carry over into their sleeping habits and prevent them from being able to fall asleep very quickly And usually these people also have very restless sleep when they are sleeping. For treatments of generalized anxiety disorder, we've got a number of different options. One of the things that we can do is prescribe medication. And if we're doing that, the common medication that's given are antidepressants. There's a number of different antidepressants that have been shown to work for individuals who suffer from generalized anxiety disorder. But there's also a lot of people that believe this is one particular disorder because it's kind of so all encompassing that these individuals think that maybe what we should try to do is really try to help this person kind of overcome their general demeanor, their general approach. So, in addition to using medication, lots of people have also kind of leaned towards things like relaxation training or cognitive behavioral therapy to really help these individuals kind of reevaluate their circumstances, re-attend to the situations that they've kind of been interacting with on a regular basis to help them overcome some of the anxiety that they're producing when they're in their daily lives. Fortunately for us, both medication and these relaxation therapy techniques have all been proven to be fairly effective. So, even though 1 in 20 people suffers with this particular disorder at some point in time in their lives, if therapy is used or applied to these individuals, their anxiety levels can be lessened. They might not ever be 100%, or I guess perfectly what we would call normal, but at least their anxiety levels could be manageable. And that's very promising and very, I guess, positive in this particular respect, especially when we compare it to some of the other disorders that we're going to be discussing in this class. The next type of anxiety disorder that we want to talk about is something called panic disorder. And panic disorder is similar to generalized anxiety disorder in the sense that there's usually not one thing in particular that these people have anxiety or issues about. But instead, what we see with panic disorder, I guess what we see that makes panic disorder distinct, is the fact that instead of having a continuous level of anxiety, people with panic disorder just have brief bouts of very extreme anxiety. In fact, we call their particular moments of anxiety panic attacks. And panic attacks can be very, very profound when people are experiencing these. What we see most of the time with panic attacks is they last a minute to a few minutes, and they just cause the person to be simply cognitively and physically overwhelmed by the fear reaction that their body produces. What's interesting to a lot of researchers is the fact that these panic attacks can actually vary from person to person. So some people feel heart palpitations, others feel like they're choking, some feel like they're going to pass out. It all varies from person to person. And just to give you a sense of what a panic attack feels like, how a panic attack would be experienced, there's a video attached to this particular lecture. I'd like you to open that up at your convenience so you can see this individual describing his first panic attack and really get a sense of how overwhelming this particular experience can be. Now, just having one panic attack does not necessarily qualify somebody as having panic disorder. Instead, what you need to do to qualify as having panic disorder is have frequent panic attacks within a fairly limited period of time. Usually what we see with panic disorder is this is a very comorbid disease. Or comorbid, we don't like to call it a disease anymore, we call it disorder. What that means is that it's often paired with other types of disorders. So one of the more common ones it's paired with is phobias, namely one particular phobia that we call agoraphobia, or a fear of being outdoor in exposed areas where we're not allowed to get away or we're not capable of getting away very quickly. Most researchers believe that these phobias are paired with panic disorder because eventually what people will start to do when they're experiencing these frequent panic attacks is try to figure out the cause to them. Essentially trying to find a link to what's actually producing these panic attacks. And since most people tend to experience more panic attacks out in the open, in places where they don't have the ability to get away, and when they do experience them, these panic attacks can be even more terrifying than ones where somebody's kind of in an enclosed area. Oftentimes what will happen is people will start associating those exposed areas, those places where they can't get away, to the panic attacks themselves. And because these panic attacks are so fear-ridden, Eventually, that fear kind of gets transferred over to the actual experience. It's not a very popular disorder in terms of how common it is. Only about 1 to 3% of the population will be diagnosed with this disorder at some point in their life. With this particular disorder, what we see is that there's a number of treatments that have been kind of applied. One of the common ones, again, we will do for these individuals is prescribe them antidepressants. But another thing that we can often do is try to help people with either behavioral or cognitive behavioral therapy in order to help them overcome kind of some of the symptoms that they're displaying, and more importantly, some of the associations that they're making with their environments and with their experiences in these panic attacks. Fortunately for us, even if people don't necessarily seek treatment, one nice thing we see with panic disorder is that it does seem to be something that kind of ebbs and flows. Namely, it will come in, people will experience it, it might get worse and worse and worse, and then suddenly it'll start to abate. And with time and age, oftentimes what we see is that panic disorder can entirely disappear within an individual. And the odds of kind of going back, or what we call the recidivism rate of panic disorder, is fairly low. So lots of people will have this for a short period of time, and unless something really exacerbates the situation or causes things to get worse, eventually this disorder will go away on its own, even though more often than not, therapists argue that antidepressants and behavioral therapy is a much better option than just letting somebody kind of wait it out as this disorder starts to recede.
The next type of disorder we're going to talk about is a little bit broader than the panic disorder or generalized anxiety disorder. And that's because when we're looking at this particular type of disorder that we call phobias, we're looking at something that can relate to an intense fear, just like we saw with panic disorder. But this intense fear is something specific, and what specifically people can be scared of can actually be a lot of different types of things. So before we talk about the different types of phobias, I just want to talk about the basics. The first thing we want to know with phobias is where they're coming from. And what we see with them is that they are a very common disorder that usually is linked to genetics and some type of early childhood experience. Usually, if a child has a predisposition for developing a phobia, or even an adult has a predisposition for experiencing a phobia, it's not until they're exposed to that thing or to something in their life that tends to kind of bring out the phobic reaction and then kind of the development of the phobia. When we look at this particular disorder, though, it's really important to understand the difference between a true phobia and just a fear of something. So for me, I don't like needles, but I don't have kind of a constant thinking about this phobia. If you watched the video in our last class, you might remember the woman that was terrified of snakes, and she talked about how it affected her on a daily basis. It kind of led her away from even interacting in the parks or going on hikes. That's what we're talking about with phobias, where you've got such an intense fear of something that it actually hits your daily life. It prevents you from doing things that you might want to do simply because of the possibility of being exposed to that thing that you are terrified of. If it impacts your everyday living, it does qualify as a phobia. And when we're looking at phobias, just people who have this happening to them, we see they're very common. They're very, very common. In fact, it's the most common if we clump all the anxiety disorders together, all the phobias together. It's the most common anxiety disorder that's out there. We do know there's ways to treat phobias. Behavioral therapy, as you saw from the last video, does work pretty well. Some people don't necessarily like exposure to what they're terrified of, and if that's the case, pharmacological treatments can be used. Antidepressants and tranquilizers are the two most common ones. But with this particular disorder, the treatment usually has to be tailored to the type of phobia that somebody has. The types of phobias that exist come in three different categories. So the first, most prevalent single type of phobia that's out there is something called social phobia, or it's also known as social anxiety disorder. And this is when people have a fear of interacting with other individuals, kind of being in social environments. Another one that seems somewhat similar to social phobia is something called agoraphobia. But with this one, you see people who don't necessarily like going outside of their houses or outside of what they consider their safe places. Agoraphobia is oftentimes paired with that panic disorder that we talked about in the last 2 slides ago, I guess. And it's becoming a more and more popular type of disorder, but for now it's only found in about 1.4% of the population. Social phobia, as you see, is much greater in popularity, in terms of what people like, but how common it is in our society. And that social phobia can often be paired with the other type of category that's out there called specific phobia. And this is when people have a fear of some object or some idea. So specific phobias involve things like a fear of flying, or a fear of snakes, or a fear of dogs. There's lots of different types of specific phobias that are out there. So if we combine all of them, we actually see that specific phobias are slightly more popular in terms of the proclivity than social phobias, but each specific phobia is much rarer than social phobia in general. When we look at all of these phobias, we do see that women are diagnosed a little bit more than men for a number of these phobias, but for specific phobias in particular, women are diagnosed twice as often as men. We don't know why this is the case. We're not sure if there's something genetic that's inclining women to have these fears, or something social that's pushing them that way. But we do see these gender differences that are worth noting for this particular type of disorder. This last disorder, is a reminder, is no longer defined as an anxiety disorder. Obsessive compulsive disorder is now in a new category that I believe we call impulse control disorders. But as we're going to see here as I describe it, it has a lot of similar features to the rest of the anxiety disorders that we talked about. So in this particular class, I'm going to put it in with the anxiety disorders, but I do want you to know that if you get into clinical psychology, you will see it in a separate category. And before we talk about why it's usually been paired in the past with anxiety disorders, and why lots of people still will kind of clump it in the descriptions as a type of anxiety disorder, I want to talk about its prevalence just briefly. So it is a very rare disorder. I mean, not extremely rare. There's other ones that are rarer than it, but it's only found in about 1.6% of the population, at least at some point in their life. But the unusual thing with obsessive compulsive disorder is who we find it in. We do know there's a genetic link to this one, especially for people who develop it before the age of 18. But what's unusual with this particular type of disorder is the fact that it's found in a very select group of individuals. People that are described as slightly above average or average in intelligence, and also very hard-working perfectionists, are the people that tend to develop this specific type of disorder. And we're not sure why this is the case, if the personality characteristics give people a proclivity for it, or whether or not, people who have it kind of develop this proclivity to behave this way. But there is an interesting link there. Now, that doesn't necessarily mean that every hardworking perfectionist has obsessive compulsive disorder. In fact, statistically, very few hardworking perfectionists have it. But you have a slightly higher chance of developing this disorder if you've got those characteristics to you. And once you have it, you have something that can actually really impact your life. So when we're talking about obsessive compulsive disorder, we're talking about a disorder that has two parts to it. The first big thing that's important for this particular disorder is what we call obsessions. This constant thinking about things, this constant need to kind of address something in your head. And to kind of act on these obsessions, what people will engage in is what's called compulsions. These constant repetitive acts that put at ease the anxious thoughts that are coming up from the obsessions that we have. And for obsessive compulsive disorder, what you have is this continual cycle. Obsessions start to rise, anxiety builds within the person, so they act out on things. Now, the reason why many people think it's no longer listed in the DSM as an anxiety disorder is because you usually don't see much of the anxiety in these individuals. Instead, what you see is people that behave fairly normally, that are constantly doing things that they don't really want to do. So it's almost like they're annoyed with this. And in fact, after we're done with this slide, just so you can see an individual's experiencing it, there's a video that I uploaded of a gentleman describing his obsessive compulsive disorder and some of the thoughts that he has and some of the actions that he kind of engages in. And I want you to just watch it so you can see A, what obsessive compulsive disorder is like, and B, the fact that he's a fairly normal individual. He doesn't look really bothered by things, but you can see in his descriptions that anxiety is a hallmark to his disorder. It's only the compulsions that kind of prevent him from displaying that anxiety or really experiencing an extreme level of anxiety. But the impulses, the movements, is what we usually see with this particular type of disorder. Now, one thing that's worth noting for this particular disorder is that it does often get mixed up with other disorders. So there's a second disorder that sounds almost like obsessive compulsive disorder called obsessive compulsive personality disorder. OCPD is not the same as obsessive compulsive disorder. Obsessive compulsive personality disorder is an actual personality disorder that kind of takes over the whole individual. And the big difference here for these individuals is not only do they usually have a perfectionistic approach to one or two things, the need to clean, the need to kind of organize, but they usually carry this approach over to a large number of aspects of their life. So the person that obsesses about every single point on an assignment, or is terrified that they didn't read every single page of a book if you're talking about classwork, but more importantly in other aspects of life, like needing to have every single detail in your house organized, and making sure that everything you do is absolutely perfect. That's more indicative of what we call obsessive compulsive personality disorder. And the way you can usually tell the difference between somebody who's experiencing obsessive compulsive disorder and obsessive compulsive personality disorder is in their kind of interpretation of their situation. So for people with OCD, they don't like the obsessions. They don't like the need to act on the compulsions. People with obsessive compulsive personality disorder tend to think that what they're doing is correct, tend to think that everybody should act this way, not just them. And that difference is kind of how many clinical psychologists separate these two out. Another thing that's worth noting for this particular type of disorder is that it is one that can be treated. So not obsessive compulsive personality disorder, that one's kind of sticky to treat, but obsessive compulsive disorder can be treated in a number of different ways. Drugs do sort of work, but the best way to treat obsessive compulsive disorder that we find is something called exposure therapy, which is kind of a behaviorism approach where you expose the person to that thing that they're terrified of, either very gradually, we call that systematic desensitization, or very suddenly, we call this flooding usually. And that slow or gradual exposure to that kind of thing that you are really terrified of. So if you're a cleaner, expose somebody to a dirty room. Or if you're somebody that has to constantly check things, expose them to the inability to check something. And what should happen over time is as they counter this kind of lack of being able to act compulsively on their obsessions, that they'll start to realize that their fears are probably unfounded. So their house is not going to burn down if they don't check the stove, as you'll see in the video. The birds are not going to get out if they don't check the cages, again, as you see in the video. That's the type of thing that exposure therapy will allow people to realize. And the nice thing with exposure therapy is that a lot of people kind of intentionally do this to themselves with obsessive compulsive disorder, even if they don't seek therapy. So a lot of individuals will improve with or without interaction with the clinical psychologist. And there's a belief that a lot of this is because they're doing their own exposure therapies to themselves.
Just a reminder, what we've talked about thus far is one of the three different types of disorder classifications in the DSM. What we call these things, again, are all anxiety disorders, even though, as we saw here, each one of the anxiety disorders that we've covered has its own prevalence, its own characteristics, and the causes slash cures to these vary dramatically from disorder to disorder. This is, again, the first of three things that we're going to be covering. So if you can, take a break. If you haven't already, watch the videos on these, because we're going to be moving on in this next section to what's called mood disorders. And this does actually involve a little bit more discussion, a few more videos, so you can see how we kind of differentiate and classify the different mood disorders that are out there. I'll see you all soon.